Morning. There is a little bit of feedback. Good morning. Is that better? That's better. Yes. Good morning. It's Frog Jump Week, and this is the regular board meeting of the Board of Supervisors, Tuesday, May 13th, 2025. We will be going into closed session. Is there any public comment regarding closed session? Seeing none, we will break. Oh, I'm sorry. Thank you, Madam Clerk.
Item number 1, pursuant to Government Code Section 54957.6, conference with County Designated Labor Negotiators Teresa Hitchcock and Judy Hawkins regarding the following employee organizations: Service Employees International Union, SEIU, Local 1021, Sheriff's Management Union, SMU, Calaveras County Public Safety Employees Association, CCP, SEA, Deputy Sheriff's Association, DSA, Calaveras Management Union, Calaveras Supervisors Union. Item number 2, pursuant to Government Code Section 54956.9D2 and E3, conference with legal counsel regarding anticipated litigation, one case, significant exposure to litigation, receipt of claim.
Thank you. Thank you, Supervisor Toffanelli. And now we will break to go into closed session.
Boardroom appropriate. All right, so I am talking now. I'm talking about the frog jump that we're gonna have today, and the frogs are really gonna love this weather. I bet we break a record today because the frogs are really gonna like this. Okay.
Stacy, how do I sound? Can you hear me okay?
Yeah, sorry. Yes, yeah, I can hear you just fine. And I'm hearing Susan just fine too.
The sounds for that. I'm gonna mute this really quick. All right.
Well, where you were just speaking now, you sounded far away. Robin, can you hear me okay? How's that sound? I don't know if you guys don't have anything off, so I can't hear you if you're trying to talk.
No, we weren't talking. I just want to
Oh,
make sure
okay.
because you're pretty quiet in the room, so I might need to turn up the TV a little bit.
Okay. And I think that is how it is by the TVs, right?
Yeah.
Yeah.
Okay, I'm gonna try turn it up.
Okay.
Coming back in it now.
No.
I don't know why.
Okay, Stacy, will you talk for a minute? Because I turned up the TVs. I want to see if that helped.
Okay. Yes. How about now? Does it sound any better?
No, you're
How
still
about
really
the same?
quiet.
So how about that? No?
No, you're still really.
That actually doesn't seem like it's helping any. I mean,
not
I don't hear a difference.
I could try changing my headset. I don't, it could be maybe my speaker or that I'm on.
Maybe, but I think this isn't turning up the TVs, it's turning up the wrong TV.
Hmm.
So
I'm
give
gonna
me just-
change. Oh, okay.
Give me just a second.
Okay.
Oops. Yeah, I think that's gonna do it.
Okay, Stacy, can you hear me? Can you talk really quickly to see how the sound is in the boardroom?
You sound great. So how does that sound on my end though?
Still quiet. Let me test, let me do the other speaker.
Okay.
I think it Thank you, and we are now back in session. If we could all rise for the Pledge of Allegiance. Gentlemen, if you could remove your caps. Supervisor Paul, will you lead us?
To the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Madam Clerk, will you report out from closed session?
Item number 1, pursuant to Government Code Section 54957.6, conference with county designated labor negotiators Teresa Hitchcock and Judy Hawkins regarding the following employee organizations: SEIU, Service Employees International Union, Local 1021, Sheriff's Management Union, SMU, Calaveras County Public Safety Employees Association, CCP, SEA, Deputy Sheriff's Association, DSA, Calaveras Management Union, Calaveras Supervisors. No reportable action taken. Item number 2, pursuant to Government Code Section 54956.9 D2 and E3, conference with legal counsel regarding anticipated litigation, 1 case, significant exposure to litigation, receipt of claim. No reportable action taken.
Thank you. We'll move on to staff announcements. Ms. Medina.
Hello, good morning, everybody. Lisa Medina, Environmental Management Agency. And we have Dolores, Ariel, and Aurora. Aurora and Ariel are pups. They're a little frightened. They got a little frightened by the, come on, babies. It's okay, baby. Go on. They got a little scared by the clapping. Thank you. No, it's okay. It's all right. So they are 2 littermate pups. We rescued them by a Good Samaritan. We had our CHP officers and our sheriff office deputies bring them into our shelter. They were found off the road in Calaveras. They are a mix of Rat Terrier and Parson Russell Terrier, and they're very active pups. They are approximately 6 months old. They're both spayed and weigh about 17 pounds. They both walk well on the leash and are very affectionate, but very energetic. They will not be adopted together because of something called littermate syndrome or littermate dependency, which can lead to behavioral health issues, codependency, and that type of thing. So if you are considering one of these sweet girls, a meet and greet is definitely necessary in order for you to take them home. And we also have Dolores. Dolores Ransom is our lead volunteer for CCAS. She oversees our schedule for the dog walkers and also the dog volunteers. And she does so much more, including staff support with assessing our pups and keeping our staff up to date on behavior issues and or their health. So the last Focus and CCS free rabies clinic that was held on May 4th was another successful event with 71 rabies vaccines given and 16 microchips. We would like to thank Dr. Brookley Chamber for volunteering her time, our Focus volunteers, and CCAS staff. The next free rabies clinic is going to be held here at the Government Center on Saturday, June 14th from 9 to 11:30 with veterinarian Dr. Grace Bloom attending. For the first time, CCAS will have a booth at the fair this year. Thank you, Lord. We will not have any animals to adopt, but we will have staff available to answer questions regarding our programs, including our adoption and foster programs and our partnerships with Focus, their programs they offer, the Humane Society, and rescues, and much, much more. So come out and see us. That is all I have.
Thank you, Lisa. Thank you, Dolores, for all your service. Thank you. Are there any other staff announcements? Seeing none, we'll move on to recognition and acknowledgements. Item number 3, Madam Clerk.
Item number 3 is a proclamation to adopt a proclamation recognizing the 2025 valedictorian and salutatorian from Bret Harte High School.
Thank you, and I'll pass the gavel over to Supervisor Follendorf.
Good morning. So, whereas each year, Bret Harte High School selects one student with the highest grade point average to be valedictorian and one student with the second highest grade point average to be salutatorian. Whereas the coursework completed is difficult and the competition for such an honor is highly competitive. Whereas these students serve as role models for their classmates and underclassmen through critical thinking, effective communication, problem solving, and organization skills. Whereas in addition to achieving the highest and second highest class rank, these students have demonstrated many admirable qualities such as integrity, hard work, determination, and commitment to excellence throughout their 4 years of high school. And whereas these students are honored at their high school graduation ceremony, but because the achievement is so significant and worthy of recognition, the Calaveras Board of Supervisors wishes to recognize them as well. And whereas the Bret Hart High School valedictorian for 2025 is Sophia Catherine Diak Kearns. If you want to stand up, where they are. Yes. And whereas the Bret Hart High School salutatorian for 2025 is Lillian Lucia Oji. Want to stand up? So with that, we've got two wonderful young ladies here. We have scored high marks here at Bret Hart. Are there any public comments? No? No? I'm sure your parents are very proud of you today. Yeah?
Oh, here she comes. Go and step up to the
Step up to
microphone.
the
Yeah.
Podium.
I don't know.
I have one thing to say. I wouldn't be here without my parents. They're they're amazing people and they've cared for me so much. And I also want to thank Jesus because he's let me to accomplish so many things. So thank you.
Come on, Dad. Come on, Dad. Stand up, Dad. Stand up and take it. Come on. That's your daughter, Rebecca.
I couldn't be prouder, obviously. The time remaining is not sufficient to talk about all the great things that Sophia is in our life. I just admire her tremendously. And she's got the best mom. If it was just left up to me, the apple fell too far from the tree. With her mom in the picture, she's got great success coming and she's just a great kid. Thank you.
Awesome.
Thank you.
Hello. I would also like to thank my family and my parents especially, and thank you all for honoring us today.
Come on, Dad.
Hi, guys.
Hey.
So yes, we'd like to congratulate both Lily and Sophie. They're amazing young ladies and they made Bret Hart High School proud of them and they definitely made their parents proud of us, proud of them. Lily is heading off to ASU next year where she's going to be studying musical theater and minor in business. And we're just incredibly excited for her to have this journey. So congratulations, Lily and Sophia.
There we go.
So, so a student like Sophie, so we have three that went to Bret Hart. And the first two were introverts and pretty easygoing. And Sophie, from the time she was born, the first thing that, who was it, the math teacher, Mr. Sadler said, when I went to the parent-student back to school night, he said, she's very different from the other two. So Sophie is, you know, she's an athlete. She's going to go to Cal Poly and study electrical engineering. She's a person of, you know, faith and upright. She and Lily are like great friends. And so, you know, we've just loved Calaveras County and Bret Hart. And thank you to the supervisors. Thank you, Sophie.
I guess I must do this. I'm not a great public speaker either, so this is a big thing for me. We are incredibly proud of both of these girls. As Susan said, Sophie and Lily are great friends. They couldn't be more different though. They're two very, very different people. I would say opposites in so many ways, but watching them go 4 years through high school from 9th grade, becoming friends, making that connection, supporting each other. It's been a really beautiful thing to see. And I'm excited to see, you know, they're taking very different paths as well, but I'm excited to see how successful they're going to be and hoping that their connection stays the same and continues to grow. Thank you guys so much.
Is there any online comment? I don't know if I'm, okay. Well, with that, we'll bring it back to the board. Is there a motion to approve this proclamation?
Ms. Fullendorf, I'd like to make a motion to approve this with that, you know, even though you wear the purple as opposed to the red. This is a phenomenal point in your life. Your parents did give you support along the way, but you're the ones that made the choices to get to where you are now, and just carry that with you in life and you'll continue to be successful. Thank you for making Calaveras proud as a whole.
You made the choices, but you also did the work. So
Yep.
that's very good.
Being purple, I will second that motion.
With that, we have a first and a second. All in favor? Aye. Passes 5-0. Now therefore be it proclaimed that the Calaveras County Board of Supervisors recognizes these students named as the valedictorian and salutatorian for the Bret Harte High School class of 2025 on their impressive accomplishments, passed and adopted by the Calaveras County Board of Supervisors on this day, May 13th, 2025. Congratulations, both. Come up.
Thanks. Yes, that's no, no,
One, two, three.
Thank you, Sophie and Lily. Thank you.
Thank you for sharing it with us.
Class.
Susan, you all right? Okay. We'll move on now to item number 4, Madam Clerk.
Item number 4 is a proclamation, adopt a proclamation recognizing Calaveras County Fair and Jumping Frog Jubilee, May 15th through the 18th, 2025.
And I will pass the gavel over to Supervisor Andal.
Whereas the Calaveras County Fair and Jumping Frog Jubilee will be held on May 15th through 18th. And whereas 2025 marks the 132nd anniversary of the Calaveras County Fair. And whereas the first fair of record was held in 1893 in Copperopolis. And whereas the first modern day frog jump was held in 1928 and is celebrated its 97th year. And whereas the annual fair is a community event with which highlights agriculture, the arts, floriculture, and the best of Calaveras. And whereas the Calaveras County Fair generates hundreds of thousands of dollars for the youth of Calaveras County through the Junior Livestock Auction, Industrial Arts Auction, and scholarship programs. And whereas the annual economic impact to Calaveras County exceeds $5 million. And whereas the theme for the 2025 Frog Jump is Ropin' Teams and Cowboy Dreams, saluting our rodeo heritage. And whereas the community celebrates together as one and strangers become neighbors and children make memories. Is there any public comment?
Thank you so much. Jen Herndon is on our Friends of the Fair board. As you know, that does so much for our fairgrounds. I think what we are most proud of as a fair is we're so proud of our heritage, but we're actually really proud of our culture that we've been able to build, that people really are our neighbors. There is no red and purple. We all bleed green.
I like to poke at it a little bit,
Yeah.
but
Yeah.
Purple green, but.
We all bleed green. So, and where really relationships are made and people come year after year that are from out of the area because they love to just step into a place where they feel safe, their kids feel safe, and people are kind and friendly and just have a wonderful time at being a community. So I think as a Calaveras County Fair and Friends of the Fair, I think we're most proud of the community we get to build and the memories that are made every year. So, yeah.
thank you, Jen.
With that, I will bring it back to the board. Oh, is there anybody online? Okay. I'll bring it back and ask for a motion.
I'll move this item.
I'll second it.
All those in favor?
Aye.
Aye. Therefore, be it proclaimed that the Calaveras County Board of Supervisors proclaims the Calaveras County Fair and Jumping Frog Jubilee to be the signature event in Calaveras County. Passed and adopted by the Board of Supervisors of the County of Calaveras, State of California, this 13th day of May, 2025. Thank you.
As a brother over on this side, I do like to live on other parts on the other side of the bush.
Some shirts out today. Okay, that's what's how you coordinated.
Yeah.
We'll work there.
I'm here.
All right. Let's do great. Thank you. Thank you. Thank you guys so much.
I'll change you. Yeah.
Okay, see you next time. Yeah.
Well, you're on something for 30.
Yeah.
What does this do?
Already.
Thank you, Lori. Thank you, Jen. We'll move on to item number 5, Madam Clerk.
Item number 5 is a proclamation from Behavioral Health. Adopt a proclamation recognizing May 2025 as Mental Health Awareness Month in Calaveras County.
And I'll pass the gavel over to Supervisor Stomper.
Thank you, Chair. Whereas May is Mental Health Awareness Month, a time to raise awareness about mental health, promote self-care, and reduce stigma. And whereas mental health is essential to overall well-being, and every individual deserves the opportunity to seek support without fear of judgment. And whereas prioritizing self-care and fostering a stigma-free environment allows individuals to maintain their mental health and encourages seeking help when needed. And whereas the Calaveras County Health and Human Services Agency Behavioral Health Program is committed to strengthening support systems by offering tools and resources that raise awareness and help eliminate the stigma surrounding mental illness. We have some comments.
How are you? All right. Hi, you guys. My name is Danielle Thornburg, and I'm a program coordinator with Behavioral Health here in Calaveras.
Mental health has been a prominent part of public conversation and consciousness. Now is the moment to turn this heightened awareness into powerful, positive action for lasting change in Calaveras County. Communities thrive when they prioritize mental health. Knowing which programs and services are available to everyone is important when having conversations with friends, family, and community members. Speaking up about the importance of accessible mental health care and working to break down barriers to treatment are some of the few ways each and every one of us can bring awareness and help break the stigma of mental health. Mental health is deeply personal, and what works for one person really might not work for another. It is important to explore which practices and/or treatments best fit a person's unique needs and circumstances. Here at Calaveras Behavioral Health, we understand that and try our best to give each person a variety of options that will work best for them. We have programs and partnerships in place, such as the Pure Wellness Center and NAMI, that offer support outside of the clinical setting. In addition, people that attend groups at the Pure Wellness Center and NAMI do not have to be clients of behavioral health. These partnerships are open to anyone that is 18 years and older with lived experience around mental health. The Pure Wellness Center promotes well-being in all aspects of life, mentally, emotionally, and physically. We offer a wide variety of groups and resources to individuals to relax, recover, socialize, and regroup. The primary goal is to provide an understanding and acceptance of individuals with behavioral health needs and raising awareness in our community. These are the first steps in reducing the stigma attached to mental illness. We will be having a Pure Wellness Celebration Day this Thursday, May 15th. I do know it's the first day of fair. But it starts at 10 a.m. and we would love to extend an invitation to each and every one of you to join us. It goes from about 10 a.m. to 1:30 with events throughout. And it's just a beautiful way to showcase all the great things the Peer Center has to offer and celebrate the incredibly strong individuals that make the choice each day to work on their mental health. Thank you so much for your time.
Thank you, Danielle. Thank you for your service to the county.
Hi, good morning. Wendy Alt, Behavioral Health Director. And I just want to take a moment to thank the staff at Behavioral Health, the clinicians, case managers, peer specialists, admin support, crisis, the Wellness Center staff, and for all that you do. Most of the staff experience secondary trauma, absorbing the stress, the grief, the hardship from those that they serve all of the time. This year, a lot of them have experienced the loss of clients that they serve, and so it's been a really tough year. It's been a ripple effect. They have emotionally, personally, and professionally just experienced a lot of grief. These impacts also compound staff burnout. They experience things that continue to be a growing concern in the behavioral health field across the nation, not just in Calaveras, but the state, everywhere. So I appreciate that you guys have hung in there and continue to serve every day. Thank you. In addition to this, last year in our 2024 benefit for health coverage for Calaveras County employees, the #1 medical diagnosis among Calaveras County employees that receive our coverage was depression. So I think that's a huge statistic, but I will say that Calaveras County has done a great job on offering extra EAP services, especially to those first responders, crisis responders. So thank you to Calaveras County also. But this is a sobering insight. It's important to remind us every day that mental health also affects us, not just the clients we serve. So be there for each other. And thank you for that.
Thank you. Further public comment?
Yeah. Hi. I'm Bonnie Hager. Thank you for the opportunity to share part of my experience with you. I have struggled with mental health my whole life. I tried going to my regular doctor, but I continue to have more and more problems in every aspect of my life. I was detained by the sheriff at one point. They saved my life by taking me to the hospital, and from there I was sent to a mental health facility. Upon being released, my life started to change. The person who picked me up was my new caseworker from behavioral health. He introduced himself and told me about the therapist at behavioral health, the wellness, and NAMI. I had some trouble adjusting, but eventually I got into the routine of going to the Peer Wellness Center twice a week. I don't think I would have been able to get better without the socialization that NAMI and the peer wellness has provided. I see my therapist every 2 to 3 weeks, and I started to see the doctor at Behavioral Health. I had been misdiagnosed for many years. Now life is not so hard, and as long as I have transportation, which you guys provide, has been vital also. I'll keep participating and keep getting better. Thank you.
Thank you. Thank you for your strength and sharing with us. It's phenomenal. We appreciate it. Any further public comment? Yes. Nick?
Good morning, Board of Supervisors. My name is Patrick Mulroom, and I'm suffering from depression, anger, and other illnesses all my life. Now, these have caused a lot of trouble for me because in school, in grammar school, I used to get picked on and belittled and picked on and had separate fights with many of the students. Also, I've learned that autism is a disease that controls many of people in their lives, but especially me, because okay, during later in my life, I was in several hospitals around Northern California, but these never helped me just find an answer to my illness. And it wasn't until 2015, I can't remember, but in 2015 I was met a therapist, Marguerite, and she helped me with this illness and find out really the basic reasons why I had this illness much more than I've ever knew in my life. Then she contacted the Wellness Center, who also helped me to see that I was not crazy or mixed up in my head, that she helped me to see that the Wellness Center also helped me to see that much of my illness is caused sometimes through birth, not always by your surroundings or your associates or your associates. Now, I've learned a lot from Marguerite and the Wellness Center, much more than I ever could, because they've helped me, and the clients also have helped me to see that mental illness is also caused by birth, not by your associates. So I really appreciate so much the Wellness Center very much, that I have great respect and admiration and love for this association, and I will probably use it to improve my life.
Awesome.
Good morning. My name is Patrick Marion. I'm honored to be here speaking in front of you guys as the president of NAMI. This is a very important month for us with the Mental Health Awareness Month. You know, every month we come together to amplify simply powerful truth. Mental health is health. And yet, for far too long, stigma, silence, and misinformation has stood in the way of people getting the help that they need and they deserve. At NAMI, we're working to change that through education, support, and community. We believe that no one should ever feel alone in their mental health journey. Whether you're living with a mental health condition, supporting a loved one, or simply seeking understanding, you are part of a movement toward compassion, connection, and care. This year, our focus is promoting hope, healing, and access, because recovery is real, because treatment works, and because everyone, regardless of their background, race, income, deserve access to quality and affordable health care. Mental Health Awareness Month is not just about raising awareness, it's about action. So I encourage you to reach out, speak up, share your story, and most importantly, listen. Together we can build a world where mental health is value, where support is strong, and where no one feels that they have to struggle in the dark. Thank you. Have a good day.
Well said. Any further public comment? Anything online?
With that, I'll bring it back to the board.
I'd like to move.
We have a motion by Chair Hubbard.
I'll second.
We have a second by Supervisor Toffenelli. All those in favor? Aye.
Passes on a 5-0 vote of the board. Thank you very much, every one of you that shared today. Hold your head high. Please take it. We have the people that shared today, if they would like. You would like to come up and get a picture with us today? I'll go. No, yeah, please do.
I have.
And I brought you guys pen, pens, and I can find it for I know.
All of the grain. Not everyone. Better than 50%, that's awesome. I get on a knee and, you know, goes.
Okay. Okay, 1, 2, 3. One more. Okay. 1, 2, 3. Right.
Online. We appreciate all of your incredible work. Yeah. Oh, thank you. Ben. Sweet. Yeah. Thank you.
North of St. Adam.
Right. We'll now move on to item number 6. Madam Clerk.
Item number 6 is a proclamation from Public Works. Adopt a proclamation proclaiming the week of May 18th through the 24th, 2025 National Public Works Week in Calaveras County.
And I pass the gavel to Supervisor Topanelli.
Thank you, Mr. Chair. So the proclamation proclaiming May 18th through 24th, 2025, the National Public Works Week in Calaveras County. And we have a lot of public works people here today. Whereas public works professionals focus on infrastructure, facilities, and services that are a vital importance to sustainable, resilient communities and to quality of life and well-being of the people of Calaveras County. Whereas these infrastructures, facilities, and services cannot be provided without the dedicated efforts of the public works professionals, including Scott and his road maintenance crew, mechanics, inspectors, project delivery staff, administrative staff, and employees at all levels of government. These dedicated employees are responsible for maintaining, rebuilding, improving, and protecting our county's transportation infrastructure, essential for all of our citizens. And whereas in the past year, the Calaveras County Department of Public Works has delivered many projects, including safety improvements, roadway resurfacing, and preservation, striping, signage, new bridges, disaster recovery from winter storms, snow removal, and lighting district maintenance. And whereas as stewards of public interest, the Department of Public Works strives to build and maintain safe and efficient public infrastructure while protecting natural resources in partnership with our community. And whereas it is in the public interest for citizens, civic leaders, and children in Calaveras County to gain knowledge of and to maintain an ongoing interest and understanding of the importance of public works and public works programs in their respective communities. And whereas 2025 marks the 65th annual National Public Works Week, sponsored by the American Public Works Association. Any public comments? Micah.
Good morning, Chair, members of the board. As your Public Works Director, I just wanted to take a few moments to thank the board for this recognition. On behalf of the entire Public Works Department, we accept this gesture by the board to help us celebrate National Public Works Week. This year's theme is People, Purpose, and Presence, and it truly reflects what Public Works is all about and what drives our team every day. It starts with people, the hardworking staff who show up early, stay late, and give their all, no matter the conditions. They are the heart of this department. Our purpose is clear: to keep our community safe, connected, and running smoothly, from road repairs and storm response to major infrastructure projects, or the fleet and equipment maintenance that supports these efforts. Our mission is service. And then there's presence. People of Public Works staff are always there, often first on scene and last to leave, whether it's in snow, wildfires, or flooding. Our team is reliable, ready, and proud to show up when it matters the most. I'm incredibly proud of our staff, the engineers, the crews, the inspectors, our operators, and of course, our administrative team who bring professionalism and heart to their work every day. And I want to sincerely thank this board for your continued support. Your leadership helps us meet challenges head on and deliver real value to the community. So again, thank you for this recognition and thank you for celebrating Public Works Week with us. We have members of our team here today. We're all wearing our Public Works shirts as a sign of unity. Many of our staff are out in the field today performing a lot of the essential work that needs to be done. So not everyone could be here, but we do have some great people representing our team today. So thank you.
Any other public comments? Scott? No? Okay, I'll bring it back to the board. I'm open for a motion.
Move.
Of a motion by Supervisor Follendorf,
I'll second.
second by Supervisor Hubbard. All in favor?
Aye.
Opposed? Passes 5-0. Therefore, be it resolved that the Calaveras County Board of Supervisors does hereby designate the week of May 18th to 24th, 2025 as National Public Works Week and pays tribute to our public works employees and recognizes the substantial contributions they make to protecting our safety and quality of life for all.
Thank you, sir.
No, that's an essence. Oh, I didn't think that really. You're tall. You're tall. Okay.
Everybody get back to work. Yeah, right?
Yeah, I'll point it away.
Sorry.
Oh, their feedbacks. Heard on those two echoing again. The last Tuesday was cool now, so we're echoing again. It's the guy with two thumbs.
Okay, we'll move on now to general public comment. Madam Clerk?
General public comment, any item of interest to the public that is within the subject matter jurisdiction of the board and is not posted on the consent or regular agendas may be addressed during the public comment period. California law prohibits the board from taking action on any matter which is not posted on the agenda unless it's determined to be an emergency by the Board of Supervisors. If public comment is completed before the 30-minute allotted time period, the board may immediately move to the next order of business. If public comment is not completed during the allotted time period, it will be continued as last item of business in order to provide an opportunity for the remainder of comments to be heard.
Thank you. Is there any public comments?
Hello, my name's Lou Bumpus. I'm asking you to please remove item 8 from your agenda. I think $385,000 for a bathroom remodels.
Excuse me, we are not there yet.
Okay.
This is just general public comment. If you please stay and then you can comment on consent.
Okay, well,
Thank
I'm
you.
just making that statement right now.
Okay. Officer.
Good morning, Chairman Hubbard, members of the board, county staff. My name is Nick Cashy. I'm the unit chief for the CAL FIRE Tuolumne Calaveras unit. I oversee all of the CAL FIRE resources in Calaveras, Tuolumne, and Eastern Stanislaus and San Joaquin counties. I just want to give you a quick operational update as we're entering into the busier months of the fire year. Effective May 1st through Public Resource Code, we implemented burn permit requirements for all residents in Calaveras County, Tuolumne, and Eastern Stanislaus and San Joaquin. That requires folks that want to do dooryard burning or project style burning to obtain the appropriate permit. As CAL FIRE, for the local representation, we will monitor weather and fuels from now. And as things continue to dry, we will make the decision in which it's no longer safe to do that kind of burning. And we will implement a burn permit suspension for the remainder of the busier months of the fire year. In addition, from the response side, we have had 16 engines staffed in Calaveras County and Tuolumne since February 1st, and we will continue to maintain that staffing, augmenting to 22 engines in just a couple weeks as things get a little more dry. So that's our base staffing for the unit as we go into this fire year, the busier months. In addition, our fixed wing aircraft are at Columbia starting this Monday, and also our copter with water dropping capabilities and crew as well. So with that, as we enter in over the next few weeks and conditions continue to dry, it also is a good opportunity for us to do our prescribed fires. So you'll be seeing more press releases and communication on the prescribed fire and fuel reduction work that we'll be doing, also supporting community members that are doing the same. Appreciate your time. Thank you.
Thank you so much. Mr. Butner.
My name is Christopher Butner, publisher of Calaveras 2026election.com. Informed citizens might reasonably question whether the warning letter that Board Chair Martin Huberty received from the Enforcement Division of the California Fair Political Practices Commission was the consequence of a political novice's multiple innocent errors and violations with the Political Reform Act due to failing to comprehend instructions and seek guidance, leading to his failure to disclose, or whether it was an intentional act of income concealment that is ethically and potentially legally concerning. Informed citizens might then question whether Huberty's failure to disclose multiple sources of income, a fact corroborated by the FPPC, was an isolated novice incident or a future glimpse into a troubled pattern of conduct. 4 board members face ethical and potentially legal dilemmas when voting on the 2025-2026 fiscal year budget. Huberty will recuse from voting as required due to his conflict of interests holding a second full-time taxpayer-funded job as the executive director of the Calaveras Visitors Bureau. The ethical and potentially legal dilemma will be whether any of you vote yes to continue funding the CVB in the 2025-2026 budget without first correcting the July 1st, 2023 Tourism Promotion Agreement between Calaveras County and the CVB to accurately represent the CVB's California nonprofit corporation type. On August 22nd, 2023, this board was credibly informed, as was County Council and the CEO, that the Tourism Promotion Agreement misrepresented the CVB's California nonprofit corporation type. The CVB had surrendered its public benefit nonprofit corporation status in July 2021. The CVB had become a mutual benefit nonprofit corporation at that time, operating without valid bylaws as legally required. And for the 2024-2025 fiscal year budget vote, this board was credibly reminded the Tourism Promotion Agreement was misrepresented and needed to be corrected for legitimacy. The board unwisely dismissed these facts. Members of this board, by voting to approve any 2025-26 fiscal year funding for the CVB without first requiring that the misrepresented nonprofit corporation type be corrected in the Tourism Promotion Agreement, will be complicit in Martin Huberty's alleged fraudulent misrepresentation. Respectfully, that would be a very unwise choice for any supervisor currently under investigation for financial impropriety by the FPPC's Enforcement Division. My name's Christopher Butner, publisher of Calaveras 2026election.com. Thank you.
Thank you. Any other public comment, Madam Clerk? Seeing none, is there any online? None. Thank you. We'll move on to the consent agenda. Would any board members like to address any of the items?
Number 11, please.
Number 11. Any other items? Would any of the public now like to?
Yes, thank you.
Thank you.
I think $385,000 is kind of excessive.
Just pull the item.
Number 8.
Number 8.
Yes. Thank you.
Yeah, we'll come back to it.
Okay, thank you.
Any other items? I'm seeking a motion then on the.
So moved.
Thank you. Second?
On the remainder.
I'll second.
Second by Supervisor Andal. All in favor?
Aye.
Passes 5-0. We will bring up item 8, Madam Clerk.
Item number 8 is an agreement from the Administrative Office. Number 1, award invitation to bid number 24-1040-18-914 for the Building E Room Restroom remodel at the Calaveras County Government Center And number two, authorize the board chair to execute an agreement with TNS Intermodal Maintenance Incorporated, DBA TNS West, in an amount not to exceed $384,756 for the period of 180 working days from the notice to proceed.
Thank you. Madam CEO?
We're getting feedback here, sorry. So I do have staff in the room. This is, as indicated, an agreement to remodel the bathrooms in Building E. We are required to bring our facilities up to meet current ADA standards. And we've been going through a number of facilities to do that throughout this campus. This is another project in that vein. It was put out to bid. I have Jamie Andrioli here. She can talk a little bit about the bid process and how that works.
Thank you. So as it says in the staff report, we did go out to bid in the fall of last year. We did receive one bid, attempted to contract. That contractor was unable to supply a performance bond. So we were required to go back out to reject all bids at that time, go back out to bid. And then the contract in front of you is with our one and only successful bidder who was able to submit all the documents. So we did follow the public contracting code. It is less than the engineer's estimate that we did have. The work does include some mitigation with mold that's happening in the front part of the restroom, as well as making the restroom ADA compliant. So it's a pretty straightforward project. And I have Kevin, our facilities project manager, here that can talk more about the details of the bathroom if you'd like.
I'll come back to it in a moment.
Is there any public comment on this side?
Now it's your turn. Come on, Don.
Yeah.
Yeah.
You might want to address that, whatever's coming out of those vents right there, because that looks like black mold right there to me. So this is a lot of money that could be divvied up among other projects in this county. It's a lot of money. I mean, who's going to spend $380,000 on a bathroom remodel at their house or at their business? Nobody is. Thanks.
Any other public comment? I'll bring it back to the board.
384,000. You build a small house for that much. I'm just curious. I mean, the mold is an issue and that is expensive because you end up diving in deep. And we've recently had a item that came forward that ended up costing more because once you get into something, it ends up costing more. So I mean, so is that 384 contingent on the fact that they'll finish the job till the very end, or will they be able to come back for more? I mean, it is a good point that he pulled because this, I don't know. I mean, what kind of toilets are going to be in there? 384,000 is pretty steep goal.
So there are contingencies built into the project. I think it's 450 is what we have budgeted, but they can't just do change orders without coming back to the county and justifying why it would be above and beyond what's already scoped out.
Right.
So they do have an asbestos and mold report to go off of, as well as the plans for the building. So we can't do the unforeseen, unfortunately,
Right.
fully, but we do feel that we have a pretty good scope that went out to bid.
Good. That's good. And I'm just going to say asbestos is being removed. So that's a big part of the cost and them going through that whole process, the safety for the people in the project and everything. I mean, they have to be specially OSHA credentialed through the, you know, the classes that you have to do and everything. So I mean, that's a big part of the cost in going into this room.
And those bathrooms aren't ADA at all. If you guys haven't seen them, you go into a small room and then into a small bathroom as well. So it's essentially having to reconfigure all of it to make it ADA. So as you start to open up things, you just come into some of those requirements that unfortunately, so we did the best to limit the amount of walls and piping so the toilets aren't moving, to make sure that we could use, you know, not have to move connections and all that. So we did the best to keep the scope as small as possible. And, you know, when you do have public contracting, there's prevailing wage requirements and all of that as well. So the price does unfortunately
increase rather quickly.
I'll just ask, what's the square footage on those?
I don't know.
Total?
140.
Total or each? Each, so there's.
Yeah, the project consists of two restrooms, not one, and it's making them, as everybody said, ADA compliant. A little bit of reconfiguration. It's also changing and upgrading a custodial closet to meet the requirements of the custodians for that building. It's one of the last restrooms that's part of the original construction for that building over there.
Custodial closet's about how many square feet?
The closet is, I mean, it's, you open it, it's like a little
4x4?
closet. Yeah,
Okay.
probably a 4x4 closet. We're relocating that in order to gain larger area for the restrooms to make it ADA compliant. And then upgrading the fixtures. The finishes and everything are basically the same thing that we've been doing in building A that you'll see in these restrooms over here. So it's not anything that's high grade, but it's standardized throughout, the rest of our buildings. It does include, like I said, asbestos that's in there that needs to be abated. There is mold. This project is probably 10 years past due. We've been temporarily encapsulating or enclosing areas that do have current mold so that there's no exposure, but it needs to be addressed. So.
Go ahead.
I'm sorry.
No, go ahead.
Are they currently closed because of this situation?
No, the restrooms are open, but we have temporary containment that's out.
In the molded areas.
Yeah.
For safety.
Inside the wall cavities. So we have some of the wall cavities that are plasticed off.
Based on the mold report that we got, it was as long as they were sealed off and not tampered with, it didn't pose any immediate. But as soon as you open that up or start touching it is when the problem becomes what you're
Prevalent.
yeah.
Yeah, and we've had the hygienist, the industrial hygienist out twice since I've been here, just to double check to make sure that what we're doing, what we currently have in place is okay, and that we can still conduct business as usual, but obviously that's a temporary solution, and getting in there, figuring out where the mold is coming from, and then abating it and doing the construction is what we're asking for now.
Yeah, and I'm sorry, but you don't know where it's coming from, and you start pulling away sheetrock and everything else and following it. I'm a little concerned, but when are we gonna start on this project, do you know?
If you guys approve it today, we'd issue the notice to proceed right away, and then Kevin would work with the scheduling. So within the next month,
And
if
then
it
it's-
gets approved today.
And then it's 6 months to completion after that, because it says 180 days.
Well, that's the maximum time they
That's
have.
maximum, but you don't know what they're gonna run in, so.
We anticipate that there's gonna be some unforeseen work that comes out of that project. I mean, we can only give them the information we have, which is the visual inspections and the inspections from the the hygienist that came out and did the testing on everything. So I am anticipating that there's gonna be some extra stuff in there. To the amount of it, we don't know.
Is part of this bid to take in consideration some of that?
What was provided on the report, the visual stuff that we can see, we did do some destructive, but you gotta be careful on how much destructive you're
Right.
creating
Yeah.
when you're doing that. So we're giving them all that information that was part of the bid packet. So yes, some of that is included. And I'm gonna have to watch that real carefully in terms of what's included and what's not. But like I said, I am anticipating that there is gonna be some supplemental work.
I can appreciate that. Moving forward, it's imperative just not only for the health of, the employees here and the health of anybody that comes into said areas across Calaveras County, that we do follow through with this. I appreciate what, keep a, hawk's eye, not a bird's eye, hawk's eye view on it as we proceed. And that way we can be proactive on, how much it's gonna go up. Cause right now with what you told me on square footage, we're paying over $1,000 per square foot on this project, which is substantial, being from the construction trades and understanding what it takes to build even a custom home. That's high. But we throw in the hazmat factor, I understand. So thank you. With that, I'll make a motion unless we have more public comment.
I did want to say, which Jamie kind of touched on, just to make sure the public listening at home or any in the room are aware of the difference between public construction and home construction and the prevailing wages, because it's staggering. And before being in this position, I would not have grasped such a high amount.
And
I've worked prevailing wage jobs and yeah, that is substantial. You get into the bureaucratic thing, any government building being built.
I think also
Ouch.
that the term bathroom remodel, one thinks of just changing the paint color and doing a little tile work. This is far more structural work that has to get done. So thank you. So do we have a motion?
I'll move it.
Second?
Thank you.
Thank you guys.
Did you second? I didn't see your like.
I will second.
Thank you. All in favor?
Aye.
Passes 5-0. Thank you very much. We'll move on now to item number 11. Madam Clerk.
Item number 11 is an action item from the administrative office. Number 1, make a public benefit finding, and number 2, approve the community organization district allocation to San Andreas Rotary Club in the amount of $4,000.
Madam CEO.
Not too much of I don't need too much of a speech because I'm not pulling anything for bad reasons. I just want to say, Gary brought this to my attention. It was his idea and I'm more than happy to follow up with him. We just want to thank San Andreas Rotary for taking on the fireworks at Hogan. After the boosters, after so many years carried it, we appreciate the work they did. They made a decision based on their facts, but San Andreas Rotary is really appreciated for taking this up and we more than support them.
Super. With that, would you like to make a motion? Oh, sorry. Is there any public comment? Seeing none, any online? Thank you.
I just want to thank you to the San Andreas Rotary Club for taking on and continuing the fireworks. I've been involved with the fireworks for 20 years with the boosters. They disbanded last year after that last fireworks. And we were really concerned about anybody taking it over, but San Andreas Rotary stepped in and they will be continuing now going forward. And in years past, I've always given part of my discretionary funds to the fireworks there because it is a big public thing. It's a community thing. People come from all around just to see those fireworks. And one of the main things is because of how it draws such a big crowd, it's the Saturday before the 4th of July. So you're celebrating before, and then you can spend your time in the 4th of July with your family or friends or whoever. Again, I'm with Ben, and thank you very much, San Andreas Rotary, for picking up the ball and carrying it. So I will second his motion.
I didn't make a motion yet. So
I
make
thought
the
you
motion.
made, I thought you want me.
No, I just talk.
Okay, I will make the motion then.
I'll second that, sir.
All in favor?
Aye.
Passes 5-0. Thank you. We'll now move on to the regular agenda. Do you need time to set up? Okay. You want to take 5? Yeah, let's break for 5 minutes and we'll be back at 10:20. Okay, we are back. Thank you, everybody. We'll move on now to item number 24 on the regular agenda. Madam Clerk.
Item number 24 is an informational item from Human Resources. Number 1, receive a presentation from Stacy Witchell with Evergreen Solutions LLC on the organizational review conducted for the Health and Human Services Agency. And number 2, provide direction to staff on the next steps.
Good morning, Chair Huberty, members of the board, Judy Hawkins, Human Resources and Risk Director. And I'm here today to bring to you the presentation. Back in June of last year, the board approved a contract with Evergreen Solutions to do an organizational review of our Health and Human Services Agency, which is the largest department that the county has. And this recommendation came from the class and comp study that we did. And so now we are bringing back to you the recommendations of Evergreen. And I do want to make sure the board is aware, we still will be, once the board gives direction, so we will be asking for direction at the end, we will be sitting down with the different divisions and really going over this plan in detail. And then also we will be bringing back to the board any changes that comes out of those meetings. So the board will approve any changes that we make due to the class and comp. The organizational review, wrong year. So, all right, I'm going to hand it over to Stacy Witchell from Evergreen Solutions.
Yes. Okay. Well, I was gonna say good afternoon, but I'm not on East Coast time. Good morning. Thank you for having me here. Thank you, Chair and board members. We'll go through the presentation now, and if you've got questions along the way, please don't hesitate to ask. We'll hold them to the end, whichever your preference is. So the purpose of a staffing study is a little different than when we're looking at just a classification and compensation study. When you're looking at a staffing study, you're looking at, do you have the right number of staff, the right level of staff in order to effectively meet the goals and mission of your agency in this case, or overall county? So when you're looking at it, you're digging in a bit more. We're looking at resource allocations. We're looking at future planning and needs, upcoming changes in programs, like your Adult Protective Services has some big changes coming from outside of your control that they're going to have to be required to meet. And then we're also looking at compliance, performance. We're looking at all those different factors that impact and affect your staffing needs and your alignment. Okay. Your study goals for this one was really to review the current organizational structure, look at the span of control and the staffing levels. The next part was to look at the surveying the peer organizations to develop those comparisons, research best practices, and develop a gap analysis. And then to provide the county with recommendations, including position alignment, proposed org charts, and then also staffing recommendations. As Judy mentioned, the project did start at the end of last summer. And then we came back, forget the month now, but came back and did focus groups in person. We met with your staff, and we'll talk about that outreach component here in just a minute. And then obviously that data collection. All of our projects start with a lot of data, the data review, the data analysis, to better understand how you're structured and how things are being supported internally. For your project approach, this is a multi-phase kind of approach. These things don't happen in parallel lanes. We are looking at these as overlaps, so we do start with an assessment of current conditions. Then we talk about and go through methodology and approach. Then identification and selection of peer data to compile that, and then do the gap analysis, develop findings, and then recommendations based on those findings. Now, whenever you're working with a staffing study, we're not just looking at, do you have not enough staff in one area, or do you have too many staff in a certain area? We're also looking at your alignment of staff. Can you reallocate or realign resources to meet your needs? Sometimes you can do those things without bringing on additional staff. We look at workflow, work performance. We look to see, are there performance changes that could, or workflow changes that could help meet some of your needs. It's not always a staffing issue. Sometimes it's alignment. HHSA is a little particular and has specific needs in relation to looking at other departments within the county. We look at case load standards, state and federal guidelines. We're looking at service delivery, efficiency, equity, upcoming changes, community needs and demographics, staff retention and recruitment challenges, salary budget, and available funds. I mentioned that we came out for employee outreach. We met with a large number of your staff in person, met with all the different programmatic areas and met with all the different levels within the organization. And then we also did an anonymous survey. And we had 167 participants or respondents to that survey. And so what this graph is really showing you where the responses came from. So it did reach across all the program areas. It was anonymous, so while we identified the area that they were, we don't know who the individual was. One of the things that we specifically spoke to and looked at in the survey itself was really based on what we're hearing in the focus groups, and that was, have your workloads changed over the past 3 years? Have you seen a significant difference or impact in workloads? And so you see, by and large here, based on increased moderately and increased significantly, you've got, almost a 70% response rate of workloads have increased over the last several years. And I think your staff are feeling that and hopefully looking for a little bit of relief. Too many. Other things that we heard in employee outreach were current structure issues. Many areas felt like there was a lack of mid-level management and support. Your current staffing levels did not meet the workload demands. From a supervisory standpoint, supervisors generally felt overstretched. A lot of your supervisors are also carrying caseloads in addition to supervising their staff. You also have some vacancies at supervisory levels, so they're doing the extra for those other folks that are under a vacant position right now. There is a need of additional support at the supervisory level to meet competing needs. What was a pretty prevalent input across all the different departments. Some employees also felt that there were inequities in workload distribution and how cases were assigned. Workload has significantly increased over 3 years. Again, we saw that on the survey and we heard that in focus groups. From a development standpoint, there was requests for training delivery to be updated, an additional training for supervisory roles, and then requests for additional pathways to grow. With all of that, your employees are very committed to what they're doing and the roles that they provide and what they do here for the county. Their peer relationships meant a lot to them. But then ultimately they were looking for better training, technology, consistency, and communication. I mentioned methodology, so I want to touch on that just a second. Whenever you're looking at a staffing study, an organizational review, it starts with a ratio estimate, and that's really the highest level of where you begin a staffing study. And some organizations, that's all they do. But all that is looking at is how many of this classification an organization has versus how many this one has versus that one. It doesn't get into complexity. It doesn't get into all the other demographics. It is a pure ratio. So we started with that, but then we built from there and moved on. So then we incorporate workload analysis. So we look at workload complexity, the process variations, volume of work, to tie and have a better understanding of the ratio versus what the work demands are and how that varies amongst the peers. And then if we were working in an environment like accounting, then it'd be very easy to build a predictive model with just a trend line and say, based on this volume of work, I need this X number of people. And in social services and public health, it's not quite as clean as that. But we did build a predictive model that took into account complexities. It took into account, you have a large county, it takes into account travel time. It takes into account other things that you can use moving forward to predict what kind of staffing changes do we need in the future. Your peers that we utilized for the organizational study, a lot of them were very similar to the peers that we used in the class and comp study, a little variation here, because the goal here was to look for organizations that were similarly structured to you, because a lot of your peers do things a little bit different, right? So these are the ones that we selected. This was a collaborative process, actually with your leadership, your director that is not here anymore. But we sat down with her and we went through the different peers that she identified and then kind of refined that list down a little bit more. And we were looking for things like similar different demographics, population, socioeconomic status, budgets, services offered to the community. And then I also really wanted to identify those peers that had success in their metrics. Right? If you're comparing to peers that don't have reported successes, that may or may not be who you want to compare to. So we identified those through the course of the study as well. You'll see a couple of asterisks there on 2 of those peers. As we went through the data analysis, I ended up excluding their data from the study, really primarily because of their size and then the way that it was structured and their budgets. It really created 2 outliers that did not line up well with you, and it showed you as further behind than you were in relation to these others and best practices.
Just when you were doing this peer survey, it wasn't just their input on successes and everything. You also pulled down did you pull down some state data on whether they're meeting their expectations and goals?
We did. I ended up using the state data that was on their websites almost as anecdotal because some of it is pretty dated. Some of it went back to 2020, 2022, and it doesn't reflect your current staffing numbers or theirs. But I did use it for what are they reporting and showing, and then identified it here. We also requested metric data from those peers. A few of them provided it. It took a while to get that data. Most of the counties didn't track it and reported it in such a way that it was available compiled or in a dashboard or something like that. So, but we did request the data and made it available. So for the analysis, we look at overall for the agency itself, population and growth considerations. Your population per FTE is lower than that peer county median, which suggests each staff member is responsible for fewer people than in most of those other counties. But again, it does not consider specific community needs or logistics. Remember, that's that highest level, and I'm looking at total staff count for the agency. Population growth for the county is anticipated over multiple years at 1.4%. So growth over a 5-year period was near the median, indicating steady but a manageable demand on increases. The number of adults 65 and over is above the peer county average, pointing to a notably older population with specific care needs. And the U.S. Census also tracked and reported on the number of veterans by county. And so we captured that number as well to look at that and how it compared to your peers. So your veteran population sits just below the median of the other peer counties. If I could put an asterisk on that data though, remember that last round of the census was COVID. So there could be a chance that some of those numbers are underreported. So continue on with the analysis here. Calaveras, the HHSA may be experiencing moderate resource constraints in comparison to the peer counties, based on look at those numbers overall. When I looked at your KPIs, those key performance indicators, most of them fell within quadrant 2, which is that kind of 40 to 49% range of what I was looking at. It indicated that you're performing slightly below the median in staffing and budget allocations. The county faces increasing demand from a rapidly growing senior population, and your resources and capacity have not scaled accordingly. The county may need to consider strategic investments to align with peer performance and to meet emerging needs. Now, if we start to break this down a little bit more, overall staffing and budgeting, your total FTEs were below that peer median at just about 44%. Your budget that you allowed for the county was just below the peer median. Budget per FTE is slightly less than peers. So it may suggest efficiency in use of funds per employee, but it also, when you break it down to that division level, could highlight some strains in certain areas. Population per FTE is behind your peers. It suggests a better than average staffing ratio at the agency level. Again, remember, we're looking at the high level there. Your population growth, 1.4%, already mentioned that. And then the 27% of the population does represent 65 and over. When I started to look at department staffing gaps, look at human services and behavioral health, those were your 2 areas that start to show where you're feeling some strain. The model suggests areas are understaffed relative to both need, peers, and best practices. Your workload efficiencies in human services and behavioral health, those were two areas that kind of rose to the level of needing some attention. In comparison to the workload, the model suggests that these areas have a higher caseload per worker and are potentially stressing the system. We start to break it down a little bit further to classification level. Your clinicians in behavioral health, slightly below the median. It suggests a shortage of licensed clinicians, which may impact service quality or caseload management. Social workers, also under the median, may be an area of concern. Suggest potential service shortfalls in aging and adult protective services and family support. Public health, by and large, was, from a staffing perspective, wasn't as far behind as clinicians or social workers, but those health education specialists would be an area that I would watch for future needs, especially make sure you're able to meet the needs of your senior population. Another thing that we looked at was span of control. And span of control is ultimately really defined as the number of direct reports each supervisor has. And in a lot of organizations and a lot of levels, you're looking at the rule of 7, and that what the rule of 7 says is once you get beyond 7, then you reach a point where it's a struggle to effectively manage and oversee that many people. I tend to call it 7 plus or minus 2. Because I'm really looking at, if you're in that 5 to 9, you can probably effectively manage complex areas of workloads, okay? When I look here, you can see here the first one is an admin. At this point in time, your director had 11 direct reports. That's a lot of direct reports for a very complex, large agency, right? So we highlighted that one, so you'll see those highlights in red. If it's in green, it falls within that 7 plus or minus 2, and purple is less than 5. Okay, so really the area we're looking at there is the director. Under behavioral health, there was a few supervisory positions that were well over that 9. And actually in reality, in practice and what's happening right now, even your deputy director over behavioral health has a lot of direct reports right now due to the fact that she's got some vacancies in supervisory positions. So that's even underreporting the span of control for that area. Under human services, you've got a few more areas. And again, there's a supervisor in here that also has a vacant position. So those have been shifted. So you have a few positions here where you've got more than the desired number of direct reports. When you look at 2 of them, they are in eligibility. 11 and 10 is an area that I would keep an eye on. That's probably manageable for the role and the type of work that they do. But if that area grows, then I would consider splitting some of those positions out under some different supervisors to make that more manageable. Your public health structure is a little more flat in how it's set up right now. So you see a couple of areas there where they have 11 direct reports. And then you've got one, the deputy director has 8 direct reports there. So maybe an opportunity within that structure to realign and redistribute some of that workload as opposed to creating additional positions. So again, as we kind of move into some of the recommendations here, Calaveras County is efficient in some areas, but faces staffing shortages in critical service areas, especially in adult protective services, in your clinicians, and those supervisory positions. So we'd like to address those imbalances to help improve workload distribution, service delivery, and long-term efficiency, and then also help support any of the compliance needs that you have. We are recommending to realign the organizational structure and create 2 departments up underneath of the agency. And so you would have a health services branch, if you will, and then a human services branch. So that would take public health and behavioral health under one umbrella, and then all the social services and related programmatic areas under another. This would help you to better align staffing and also optimize resource allocation, workload distribution, and provide the appropriate levels of supervision and support. For your supervisory workload, we want to consider redistributing cases and responsibilities from supervisors with excessive direct reports to those with a lighter workload. So again, that helps meet some of the needs that you have within existing resources as opposed to adding new. And then benchmarking against best practices. Your industry standards for many areas of the government sector recommend a span of control approximately 6 to 8. So again, depending on case complexity and service area, we want to look to see where can we help align some of those different work units so they fall within those standards. One of the structural recommendations that we're also making is to realign compliance and create a compliance office so that your compliance functions, those audit functions that happen within the agency, are up underneath the director as opposed to being embedded within the different department areas. We want to, within the areas of health services and human services, realign some operational program functions between the assistant and deputy directors to redistribute workload at the executive level to create an appropriate span of control over functions and supervisory responsibilities. I want to shift work units under the program area managers to align, and then create obviously a better uniformity of structural design, and then also create a leadership training development program to invest in your current employees. This would allow for the development of internal talent for future leadership roles, and it provides structured learning for emerging leaders, supervisors, and senior staff. It also supports succession planning, retention, and promotions. Now, your staffing recommendations, these initial recommendations that we made here are conservative. So the initial look that we did looked at how can we help you realign organizationally? Where do you still need some support? In an ideal world with much larger budgets, there may be some additional positions that we would put on here. But this is the one that we put forward originally. And there are 10 positions in here. Primarily, it is to address creating those 2 different departments, creating that compliance office itself, and then allowing for additional support within adult protective services and then on behavioral health. One of the positions, and actually I'll talk about it on this next slide. I'll hold that thought for just a second. After meeting with leadership and going through the potential adjustments and what would be within means for the upcoming year, this is that refined list down to 5. Right. And so this is looking at moving forward. What could you do in the more immediate term to address those needs? And one of the positions you'll see here is a program evaluator within the administration and compliance office. And that would focus on child protective services. It could also support some other program areas as well. But creating that one position would free up 2 social workers within that work group. So instead of having to create new, then we can actually utilize positions you already have to meet that need. Does that make sense? So those are some of the types of things that we were looking at, because I can't be a program evaluator and do the audit function if I'm also working the cases. We've got to separate those 2 things. So that one change, it does create a position, but it frees up 2. But these are the ones that we are looking at in the more immediate to address those needs. The supervisory positions would address the need to be able to redistribute some of that workload, provide that frontline support, and help to meet the needs of your current employees. So in conclusion, the county's committed for addressing its organizational staffing needs. The proposed model will accommodate different patterns of growth and allow for adjustment based on needs. And the positions identified should be a starting point to assessing implementing staffing changes in the near and longer term. Any questions on this study?
Thank you, Stacy. Do we have any board comments? Supervisor Toffenelli?
I do. Under the findings and recommendations and realign organizational structure and create 2 departments. Of the other counties that you compared us with, how many of them have 2 different departments?
A lot of them do, or they have each of them exist within their own departments underneath the agency. So they're still under the HHSA umbrella, but they exist separately. Some of them have them compiled and organized, behavioral health and public health together, social services together.
Mm-hmm.
So it really varied amongst your peers.
So there's no common thread there on it, what your recommendations are here with 2 separate departments.
There are some that are set up like that.
Okay. Thank you.
And I think one of the things I just want to point out is that since we do have a super agency, it is a lot on the director. When you talk about 11 direct reports, I'm sure Teresa can attest to that. And so, and then really making sure that each of the areas are truly getting the attention that they need to be able to be successful in their programs. I mean, we know that, you know, staffing is difficult. We are seeing staffing numbers come up here lately. We are getting more applications for positions, but we know there's challenges. The state has made it almost impossible for all of our departments or divisions under HHSA with all of their mandates, and many of them or most of them unfunded. And so they have to meet all of these very difficult mandates and then be able to still, you know, serve the public in a manner that they have all, you know, they put their hearts and soul into serving the public. And so the idea of having those two areas is just getting more support and attention to those deputy directors, managers, program managers to help them be successful in their areas. And we do know that there are concerns in this time that we're in with unsure funding, what's going to happen. And so just so the board knows, I am working very closely with our assistant CEO, Marcos Munoz, on how we can put a plan together. And not everything can be done at once, but how we can roll this out, maybe even over several years, and have the least amount of fiscal impact to the different divisions as possible. And then Marcus and I will be working with each of the divisions to help develop a plan and then come up with realistic timelines to be able to do this. And then of course, we will work with the unions and then also bring a plan back to your board.
Yeah, I thank you for bringing up uncertain funding, because none of us know with the federal dollars coming down right now. And as we move forward, you know, committing to some of this, certain funds may come back and we may have to pull back. And it's unfortunate because all these services are needed. But if we don't have the funds to provide them in the future, depending on what they may be, our hand may be forced, and we may have some people in our community that are in need. And we may have to not just find the realignment that we're suggesting here or whatever it may be when the board decides, but realigning some of those services and finding a way how we can provide them, or working partnership with other entities to provide this. I want to say that because we commissioned this report, some time ago, or study, excuse me. And now we have it and things are in flux. I mean, things are always fluid, but it's a waterfall right now. And, a flood, we don't know which way the water is going to go. So
But I'd like to add, just from the proclamations earlier, when I forget who was talking about it, but depression. I mean, when we hit these times, depression is going to hit a lot of people, and that there's going to even be more need for these services. So, is there any other board comment? Supervisor Fallendorf?
Yeah, I know you're talking about the services provided, but I think it's also just internal, just what is gonna make the most sense to make sure that the employees are feeling supported to be able to continue what other services are provided in the future. Cause I think that, that's why we're here, is really to support the employees right now to make sure that they can continue as these workloads continue to build up. And we need to make sure that they're getting that attention and the tools they need to be successful. Otherwise, all of these services to the public aren't going to be successful at all. So I think we need to make sure we're taking a step internally because we're only as good to the public as we're supporting the staff right now. So I'm open, I mean, we asked for this for presentation, and so I'm open to this, as long as staff knows that this is gonna be, it's gonna be some bumps in the road as we go through this process, but if we're gonna go through this to support what they need, we need to go through that bumpy road to get to the end of it. So as long as everyone knows that, and that's our intent, I think we can have something successful in the next, in the near future to keep those services to the public.
Supervisor Stopper.
Yeah, are you done? Okay. Ms. Fullendorf pulls up some great points there, and I completely agree with her. And I would like to add to that, so giving them the tools to provide these services successfully, at the same time, setting expectations and goals for them and holding them to them, so that not only are we getting people in the right area, hopefully, a better pay for what they're doing and how much they're working, but also making sure that, those are the duties and everything that they're doing and following through with to the end. I mean, it's all part of the big picture, but yeah, part of my fluidity and providing services is, of course, what we're addressing here with the employees. So thank you for Amanda for clarifying that.
So one of the things I would also just like to remind your board is that when Evergreen was doing the class and comp study, they did these very focused groups. They did a lot of focus groups. They sat down and listened to the employees. They also sent out a survey to the employees. And they listened to what the employees were saying, which is why we circled back and then did this org review. And then once again, they sat down and listened to the employees, sent a survey out. And that's one of the things that, we are listening to the employees and then now trying to roll out what is beneficial for everybody. But like I said, it won't be all at once. It will be a process due to our uncertainty of funding, but we would like to get direction from the board and then bring back to the board a solid plan on how we can accomplish what Evergreen has identified.
So could I ask you, Judy, you said going forward that you were going to be working with everybody. What is the process of that and how long will that take?
And so today, if the board gives us direction to move forward with this org review, then we will try to sooner than later set up meetings with the different divisions and then go through, because there's a few areas that were, need a little bit more information on, and then we will sit down with them and make sure that our recommended org charts are in line with what they do and what they need. And then once we have a full plan, once we know what the impact to staff will be, we will meet with the unions and then we will bring the plan back to your board. I'm hoping that we can get this done within the next few months.
And is that something that we do completely in-house and Evergreen is now done with the study?
We have their recommendations. And so then the assistant CEO and myself will meet with the divisions and then go through the recommendations, what can be done now. Our assistant CEO is very aware of all of the funding sources. He's also staying on top of what is shaky and what seems a little bit more stable, if there's anything that we could call stable. And then, like I said, we will come up with solid recommendations, working closely with the different divisions under HHSA, and then bring the full plan back.
Thank you. Supervisor.
I just want to add something. I want to thank Evergreen. Now, crucial employee input and everything. Each person has their own idea of how things should be in their perfect world. And you got to take, how many was it? 100 and some odd different inputs.
It was
Filter.
more than that, but
Yeah.
67 on the survey.
167 on the survey. And 167 different opinions. and filter through those and come up with what you had. I just want to thank you for the work you did. You know, everyone can have their vision of what could have been better about it, but filtering through all that with Health and Human Services, thank you.
Here for your technical support, questions, if you want to run something through or see if we've got data available in your technical something. So just let us know.
Thank you.
Thank you. Is there any public comment regarding this item? We'll just move. Any other board comment? No comment online? Then we'll move straight on to item number 25.
We need directions, sir.
Oh, I
So-
apologize. I thought, yeah.
I mean,
You're-
just forget about it, and I think these
Yeah, no,
people,
no.
it's like, what the heck?
You're absolutely right.
So we would like direction if the board is willing to move forward in the direction that Evergreen has indicated in their study in the report, if staff is free to go forward and meet with the different divisions and go through the recommendations and then formulate the final recommendations to be brought to the board.
See, I know my board so well, I felt it through osmosis. Thank you. Supervisor Stopper,
You're gonna let me go first again?
again.
You know, this needs to be done at the same time, timing. I'm having a hard time with the timing and not knowing what's coming down in the future. So I think I want to proceed with restructure, but I think that more input and the work that goes into this point, that this may not be the final thing brought back to the board, and I want to be open to that. So I would like to proceed, but I have an open mind to that this may not be exactly what comes to then. If I don't want to, I want us to, I think we need to slow walk this one a little bit. And it's not to the detriment, but as long as it's not to the detriment of the whole organization as a whole.
Madam CEO?
So I was going to say that's exactly the intent, is for our assistant CEO and for our HR director to work with the different divisions on which parts of the recommendations should be implemented and when that implementation should take place. We recognize that it's a lot of data and it's a lot of information that Stacy has put together for us, and we appreciate your work because it's been a tremendous undertaking. But we do feel that we need to work with the individual divisions on what is practical and how those recommendations would be rolled out.
Supervisor Toppinelli?
Yeah, I'm in agreement. I'm going forward and how we're gonna roll these out in these departments. Not sure all of it's gonna fit for us, Calaveras. Again, going forward, we don't know the future, what's gonna happen funding wise, especially with the federal government and even the state government, because if the feds take money from the state, it's gonna trickle down. We're not gonna get the funding either, but I'm willing to move forward on it and take our time and go slowly. There's a lot of information here. And I appreciate your presentation to us and the time spent doing it. But yeah, I'm willing to go forward, but we just need to be careful.
Thank you. Supervisor Hollander?
I agree with Gay and Ben, and go forward with, you know, knowing that it's not gonna be exact, but I think we need to do what we can to get the support our staff needs right now, and then we'll figure out where that money that's going down, I guess.
Thank you. Supervisor Randolph?
I'll echo my other board members. I really appreciate your time listening to the staff and going through the motions. And I think our staff is aware of the fiscal climate around us and understand our need to slow walk this and get to the end point at some point. Thank you.
Thank you. I want to echo all of my supervisors and say, yes, let's go forward, obviously cautiously, but thank you so much. And thank you so much for all the work. Yes, okay, we'll entertain that.
Sorry. Anon, you're able to talk now if you'd like to make your public comment or your comment.
Good afternoon, Board of Supervisors. I'm reviewing the study that was released and the considerable amount of time and expense that was put onto the county for this information to be presented today. I would just like to echo some of the concerns that some of the supervisors were pointing out, and I would like there to be some special consideration into the amount of cost of increasing the number of management positions within administration and how much of that cost might be able to be funneled to actually supporting the direct service provision that I think so many of you have said is so important for your constituents in the county. I'm hoping that there's going to be some consideration put into there and, talking about the financial place that the current United States administration is in right now and the possible foreseeable cuts to Medicaid and some of the funding sources that provide those direct services to your constituents. I can't kind of wrap my head around why there would be such an increase. You're talking about at least $500,000 of administrative positions to the county with moving forward with a plan like this. So I'm just hoping that you all are taking that into consideration as you move forward and you have these conversations with the divisions, looking at those funding sources that are, at risk of being taken away within the next couple of years. Thank you.
Thank you. So I think we have our direction.
Yes,
Thank
thank you. And of course, we will work, move cautiously. That's why I am working very closely with our assistant CEO so we can make sure. And there are some changes that we can make that won't have a cost. And it's just really looking once again at that span of control and what can be shifted around, what can be. So there may be some things that we can make immediate impacts on. And then also with, concerns, you were saying, with the concerns over mental health crisis increasing, that we can have a good plan where staff can work effectively and efficiently.
Thank you. Now we can move on to item, sorry, trying to keep it moving. We're going to jump a frog, We'll move on to item number 25.
Item number 25 is an informational item from Human Resources. Number 1, receive a presentation from Stacy Witchell with Evergreen Solutions LLC on the elected officials compensation study conducted for the county. And number 2, provide staff direction on next steps.
Stacy and Judy.
Right, Judy Hawkins, Human Resources and Risk Director. And we are bringing to your board today the outcome of the classification study done for elected officials. And also bringing forward some options for how the board compensation is considered or brought back. And so once again, Stacy has since last November worked on this for us, and she has a presentation.
Thank you. We'll talk about the elected officials and that we did. Thank you. So when we did the class and comp study and presented on that last year, some of the classifications it did not include was the elected officials. And the thought, I believe, was to come back and look at them separately after the first study was concluded. So that's what we did here. We looked at the elected officials. We looked at not just that market comparison and the market peers, but we also looked at how salary adjustments were made, how they were set, and that process for changing them in the future. So the study approach here was to review the current salary structure and method of adjustments, hold focus groups, interviews with elected officials, survey peer organizations to develop comparisons, research best practices, and calculate market position, and then provide the county recommendations, including salary structure, internal alignment, and approach to adjustments moving forward. So above and beyond just comparable salaries, we looked at ordinances of each of these different counties. We looked at how they established salaries, how they adjusted salaries, and found that there's a variety of ways that your peers have done that over time. Mentioned that we met with each of the elected officials that were part of this study. And this is the kind of overarching comments that were provided, areas of concern that was provided by those elected officials. There was concern related to equity for elected positions. Four of them had the consistent pay across the positions, and the scope of responsibilities and their roles differed. So there was a question about that. Equity with department heads. So internally, your elected officials, by and large, act as department heads over their areas. How their salaries are set and adjusted does not align with how your appointed department heads' salaries are set and adjusted. So there was a question about that. Salary adjustments, the manner in which salaries are adjusted, not consistent with peers. And there was a preference for an objective and consistently applied approach to setting and changing salaries in the future. From a compression standpoint, there was a concern over current or potential compression in salaries between electeds and then their county employees, those direct reports. And again, there was requested an approach to help minimize any compression now or in the future. And then externally, there was concern related to salary competitiveness compared to peers. Want to ensure competitive and comparable compensation to attract and retain those quality candidates and officials. These were the peers that were identified through a collaborative process again to collect data from. So you see, all of the 12 or so listed there. We were again looking for similar demographics, population budgets, proximity, services, and then role of the elected positions. Now we looked at a variety of your peers. And again, just like we did the class and comp study, whenever I'm looking at salary dollars and ranges, I apply a cost of living adjustment. So we make sure everything's at the value of your dollar here. But we did a little more specifically want to take a look at kind of what's the averages across those peers. So for here, you're looking at population budget, square miles of area, that's land and water, and population growth rate on an annual basis in relation to those kind of peers. And you'll see there that the peer outliers were identified as El Dorado, Placer, and Stanislaus due to both budget and population. So I looked at them with and without. I looked at the data with both. Calaveras falls below the average county population. It's greater than the peer budget average without the outliers. Growth rate is below the average, and then overall, there's less area as compared to peers. So it kind of gives you an idea where you stand in relation to those peers that were selected. And now, based on looking at the salaries of these elected positions, and we looked at board chair, board member, assessor, auditor, controller, the clerk, recorder, district attorney, sheriff, and then that treasurer, tax collector. So those are the positions that we looked at. If I looked at all of those counties, including your outliers, then you can see where your differential and salary comparisons are. So your auditor controller was the one that was greatest behind market, and that was at about 14%. And then your board members are about 1.5% to 2% behind the market position. If I look at it with outliers removed, then it improves that position a little bit. Your auditor controller is still almost 13% behind. Board members pretty close to market. And then your other positions are floating, anywhere 4 or 5%. When I look internally at the comparison to appointed department heads, and we aligned them based on the study that was provided last year, we would have aligned county clerk, recorder, the treasurer, tax collector at equivalent of a pay grade of 4,005. Auditor, controller, assessor, we would have aligned at a 4,006. And the DA and sheriff, we would have aligned at a 4,008. And if I look at those as compared to the midpoint of those salary ranges, then they're 5, 6, and 8% behind. So for peer approaches to salary adjustments, that's another thing that we looked at. So not just what their salaries were, like I said, but also how do they make changes to these salaries over time. For board members, many of your peers went consistent or a percentage of state superior court adjustments. That way that was the plan moving forward for more than half of them. A couple of them averaged 3 to 5 of their neighboring peers and then did the same adjustment. But then many of the peers they were averaging against also used the state superior court as the method to make those adjustments. And then some of them voted increases. One of them have not done adjustment for their board members since the 1980s. So it's not much change for a couple of them. For your elected offices, it was either adjusted within an agreement, voted increases, tied to board salary adjustments, or it was tied to bargaining units within their office or department. So recommendations moving forward, I think even more so than salary, is how do you want to make adjustments in the future when they're warranted? So for board adjustments, I would consider a weighted approach that includes both the local market considerations and cost of living adjustments. For your assessor, auditor, controller, for those other 4 positions there, elected offices, I would separate that adjustment consideration from the board. I would align the appointed department head salary schedule as appropriate, and then maintain an internal and external market equity using a weighted approach moving forward. So much like when we looked at the original class and comp study, it was an approach based on both internal and external equity, following a similar methodology for them. Sheriff and district attorney, sheriff, the salary should consider statewide law enforcement trends. And then I'd also look at 3 to 5 comparable counties to make sure you're staying in line with that market. For your district attorney, necessary adjustments should consider, again, compensation trends of those regional public attorneys and 3 to 5 comparable counties. And also look at internal equity since you have legal counsel internally. Fiscal considerations, I would consider maintaining salaries within a 7% margin of the regional median. That way you can maintain a level of comparison without trying to be right at or even leading the market. I would cap adjustments in any given year to a percent not to exceed the average of any county employee adjustments. So I'd make sure that you stayed within line of employee adjustments and not exceed that. Establish compression policy to ensure a minimum of 15% between salaries of the elected official and then that second in command. So that way you can address any compression issues between those salaries now or in the future. The estimate of adjustment, I did utilize a weighted approach based on internal and external equity. I did look at the median or that midpoint of the salaries of those pay grades, but then I reduced it. So I looked at 75% of that position. So I didn't want to look at too aggressive of an adjustment. It does not include a step plan adjustment. Future adjustments would be formula-based and defined in policy and dependent, of course, on available budget. And then those 4 positions would be differentiated based on scope, role, and responsibility. So we looked at that on average, and this was looking at data at that point in time. It would have been about a $59,000 cost estimate, which represent about a 4.5% increase to address the current position. Yes, sir.
How come those numbers are different than what we have here on our computer? Our agenda item says 51,765.47, 6,470.88 or 68, and a 4% average. They're not the same.
I think there was an update. So I think what you're looking at there, I did adjust them. When I was running the calculations, I looked at adjusted to 75% of calculated position. I reduced that to a 60% of weighted. And I was looking at cost estimates. And so I think that's what an error may have gotten uploaded.
So what we did is, for the agenda item, we pulled what Stacy had provided, and then I did ask staff to make sure and get the correct. So what had happened is the timing between when we turned everything in, to make sure it made the agenda. My staff then sent the PowerPoint, and so an adjustment must have been made to the PowerPoint between that. We can make sure that we do get copies for anybody that is wanting them.
May I ask something? So that adjustment was made within the last week?
Yes.
We should have got an adjustment or an email or something with those adjusted numbers on it. But go ahead, that's fine.
I did not catch that.
That would have been, that was my error. I apologize. When we were looking at the cost estimate and what it would be, I was looking at the 60% of that midpoint. And that's the number that I uploaded when I was looking at different budget adjustments and ideas and what to put forward, but we had settled on 75% and I forgot to update the PowerPoint. So that's my fault. I apologize. We look at the recommendations broken out by the elected position. You can see what the adjusted salaries would be. So you see the current salaries there in that second column, the recommended salary, and then that percent difference between. And you'll see that this is a weighted approach. Even your auditor controller, which was 14 or 13% behind, depending on whether it had outliers or not, we're not bringing that to 14% of an adjustment. But based on internal and then based on that weighted approach and then coming in at 70% of midpoint, that would be an 8.6% adjustment. So we didn't try to truly align you guys with market. It was, like I said, a weighted approach. And that's it. Any questions on this?
Any board comments?
Can you expand a little bit on your methodology of your weighted approach? That's,
wait,
so
for
that's
part.
the internal, the external, and the percentage that you gave us here. This is the 75% weighted approach that we're
Yes.
saying?
This is a 75% weighted approach. And that's why you'll see that these numbers don't necessarily align with what you saw in that market survey. Most of them are less than what the market survey allowed for. But then what I did is I looked at for the board members, I don't have the report in front of me right now. It was I think we looked at 40% of local position, 40% of cost of living, and then only 20% of what is the state Supreme Court would be doing. So that the foundation is much more locally based and not aligned truly with the state Superior Court or just based on market and COLAs. It kind of blended all of those together. So it kept your peers in there with it and it weighted local conditions. So that's how we did those ones. And then the other positions, auditor controller, county clerk, recorder, registrar, it's weighted on a percentage internally and externally, just like we did with your class and comp study. So it addresses both internal and external with caps, of course, because you don't want to exceed staff adjustments in the future. And then I would also, as a former public sector employee myself, everything's always dependent upon available budget funds.
Correct. Supervisor Stopper, do you want?
I'm just cost of living index and Calaveras being high. And I was trying to wrap my head around that as opposed to like it being higher than YOLO, you know, throughout, for example. And then I realized that we have less available housing. You have to drive farther to get to a store. I mean, overall, it's surprising to me that as a rural county, it costs us more to live here when people move up here to save money. But then I look at Mariposa and they're up to the roof above us and they're even more rural. So.
Comment regarding this item? Is there any comment online?
No.
No, I'm not. Don't worry. So you're looking for direction?
Yes.
So yes, we are looking for direction and with bringing back the salary adjustments as recommended by Evergreen, and then also bringing a compensation policy for the elected officials, including your board, bringing that forward for adoptions so that we have a set plan going forward on how we are reviewing and calculating out the salary changes for your board.
Supervisor Stopper.
Sure. I personally would be comfortable with bringing forward the policy first. I've always had a hard time with voting on my salary and having it tied to everything the way it is. I just have a hard time crossing that bridge. So my opinion, bring forward the policy first. We'll see where we're at and then let's discuss
I agree with
the other people.
Yeah, I agree with you, Supervisor Stopper. and bringing that forward, that policy first. And getting some sort of separation. I think it looks like the rest of the board agrees.
And I do want to throw in there as well as when we bring this policy back, we would like to untie the elected officials from one another because we have the 4 elected officials that their salaries are tied together. And we would also in that policy like to untie those officials.
Is that okay with the sheriff? You're the one I want to please. It's the difference between a padded room, you know? No? All right, you're good with that?
Yeah.
All right,
Say so.
if you want to.
Sheriff.
I doubt that. Good morning, everyone. I would say I do like Evergreen's presentation. I'm glad they did it. I think taking a formula-based perspective is really good for our county. I continue just to bring up the issues with compaction all the way through our ranks at the sheriff's office. We have, 4 different unions and 1 management unrepresented and an elected in our department. So there's a lot of different MOU issues and things to deal with, but that's the only thing that I ask with the policy moving forward is the compaction issue, because eventually ranks are going to pass over each other. And what's the motivation for our professional leadership to take on more roles and responsibilities without the compensation? With that, it's an unfortunate timing that this elected class and comp was removed from the rest, and it wasn't done at the same time as the appointed and everyone else, because now it's highlighted and now we're going into budget uncertainty. And I'm never going to advocate to increase wages of department heads when we're looking at having to take reductions that are affecting services and programs for our citizens. So that's it.
Thank you, Sheriff.
Well said. I can agree more. Yeah.
Is there anything else you need, Judy?
Just to make sure that I understand we are going to bring the policy back first.
Yep.
And then we will go from there.
Perfect. Thank you. Madam Clerk, item number 26.
Item number 26 is an informational item from Economic and Community Development. Receive an update and presentation from Economic and Community Development and Information Technology regarding broadband projects and opportunities in Calaveras County.
Ms. Galino, Mr. DeGroot, you're up.
Good morning. Mic's not working either.
Oh, no, hit it one more, you're on.
There you go.
Oh, there we go. Good morning, Chair Hubbard, Honorable Board of Supervisors, Kathy Galino, your Director of Economic and Community Development. I also have Len DeGroot, our fearless leader and Director of Information and Technology. We're going to do a quick update for you guys regarding broadband. And as we were sitting in our seats, we got an interesting email. So we'll go ahead and get started. So we're going to give you an update on the grants and the projects that we've been working on since last year. Our project areas that we're focusing on as things have gotten a little bit tighter with funding and more competitive. Program funding updates, future things to keep our eyes open on and updated on, and then we'll open it up for questions and answers. So what's been done so far? So in 2022, we completed the broadband roadmap.
which was a successful partnership with both Central Sierra Economic Development District and Golden State Connect Authority. We have the broadband strategic plan that was also completed in 2023. That was part of Golden State Connect Authorities and the county's agreement. 23 through 25, we did the local technical agency assistance program, which was the LEDA grant, where we received $500,000 to do both high level and low level design of our most vulnerable populations in areas where we wanted to work through the middle mile. This has since been updated. The final payment was received and this grant has been closed out. So we received the payment, I believe it was on April 17th for $429,918. And we paid Golden State Connect Authority, who then also paid for tech services, Tilson and Utopia. So that's good news. We were going to talk about the digital equity grant, but as we just found out, the U.S. Department of Commerce has canceled the program. So it's been canceled in California. So not a surprise, but a disappointment. So I'm going to go ahead and turn it over to Mr. Dickert.
As we speak, there's certain portions of the Middle Mile project, which provides backbone for infrastructure and for fiber to the home infrastructure and other broadband, is underway. Volcano is working on the planning section on Highway 26. There's one edit to this map that didn't get captured. Right now you see the Middle Mile extending up to Arnold on Highway 4, and it actually stops at Murphy's since that change. So things have been changing quite a bit, and it's kind of tough to keep up with it all. So that it's great. Volcano has been working with the county. They've checked in with us. We've been trying to help them coordinate on connection points. And so that's moving along very well. On the federal funding account side, we're in the middle of round 2. Yeah, so on the federal funding account, which is the state funds, we had a $30 million allocation. We are in round 2 and an application has been put in by Golden State Connect. We are, in conjunction with us and our input, trying to target some areas. They are applying on our behalf and awards are expected in the fall of this year. Golden State Connect is not the only applicant. We've been told that Caltel, Volcano, Frontier, Comcast, and I believe AT&T are all applying as well. So there should be a lot of competition for that funding, for that infrastructure.
And I'd just like to add that when we went for round 1 funding and we did go testify, Supervisor Vollendorf and Chair Huberty before the CPUC, there wasn't as many people applying for this funding, and now there's quite a few. So
And we didn't get round 1, did we?
we did not.
No, we did.
We were pushed into round 2. We were one of 6 counties in the state
that were
got
pushed
to round 2.
The question going into that is when we started this out and Supervisor Garamendi and I were sitting down with your predecessor, working with RCRC, Golden State. My understanding was we were right behind Alpine County. Alpine County was #1. How did we get pushed out after we went from 2nd place to what, 6 other counties? You say? So what, 49th place?
I think what happened is a partial award was made to Comcast, which would have meant that a Golden State award would not have been feasible at all. So that's why we went to the CPUC and asked them to reconsider. And what they did then is they pulled that other award and they punted to the 2nd round.
Right, and Comcast was not awarded the 17 million that they were seeking at that time. They just put a hold on the whole thing. So, I mean.
So Comcast doesn't have the money yet and it's on hold, so they may not be awarded it or it's in flux.
So that award was canceled, and so the full $30 million was pushed into round 2.
So, yeah, so.
That could be good and that could be bad because the way the state goes, oh, they're like, perfect.
Yeah.
We'll push it to this round 2, so maybe you can have a chance or maybe we'll sweep it all back. Okay.
So the next picture kind of talks about the areas where CalTel is focusing on. We are working collaboratively with both CalTel and Volcano and any others. We want to collaborate, we want to work together. We don't want to duplicate efforts, so we really want to focus on doing the good things. I don't know, Len, do you want to?
Yeah, this is a federal loan as opposed to a grant. So it's far more secure than some of the other federal funding that we're looking at. So they are in the middle of getting all of their permitting done. We've met with them and with Public Works and planning. And so that's well underway, and they hope to break ground, I believe, this year.
So the broadband equity and deployment, so again, these funds, the digital equity piece has been eliminated at this point.
Yeah.
So I don't know that there's much to speak, I mean.
Well, sure. I mean, this is going to be the funding that's most in flux, right? Unlike the FFA funding, this is not an allocation that goes to the county. What it does is there's a large pot of money where applicants can apply to build in certain areas. So the structure is different. We won't have an allocation to go fight for necessarily. In terms of sort of the implementation of it, there's a lot of rumors and conjecture about this program, but it serves a lot of rural communities. And so a lot of the conjecture ends up being, well, maybe they will open it up to more types of services to get it done cheaper and spend less money. So more satellite, more, microwave, those kinds of things. But we're still waiting on sort of direction as to how that is going to pan out. And I mentioned this already, the service providers, we have a lot of service providers who are really active and interested in building here, and we're doing everything we can to help support them, including in meeting with planning and Public Works, Kathy developed a guideline that we posted on the website for them to understand how to operate within the county and how to get through the permitting process more quickly.
So the future, so we are going to continue to outreach to our communities and partners for projects, prioritization. We're going to see where the funding takes us and how we can get the most done. We want to ensure digital equity, but that's no funding for that right now. And digital literacy, which is a big thing that CCTV, who's here today, Sarah's here, and our folks at Public Access TV and our librarian have a lot of resources that we will continue to try and leverage along with, our senior providers network and other resources. We'll continue coordinating our internet service providers for CASA funding for actual deployment and infrastructure financing or funding. Utility coordination, obviously, Len just spoke to that. And if you go to the GIS, or it's not GIS, it's the broadband portal on the county's homepage, you can click and get a bunch of information, how to streamline the process. We do have a dig policy. We do have streamlined permitting. And then the other issue that the future may hold, and Len knows more about this because he did it in Tuolumne County, is determining whether a CEQA, a countywide programmatic EIR, is something that the county would be interested in the future.
Right. Now, program EIR, in Tuolumne, when we did that there, essentially what we did is it was a product that ISPs can use. We do a preliminary EIR for all county owned and operated roads, right? So if an ISP wants to go in and build, it's a much faster process for them. The question that I think we have to research for here is whether we want to follow up with the same kind of thing here, and if we can find funding for it.
So with that, we'll entertain any questions or?
I think the EIR thought, I mean, I'd have to know what the cost for doing a countywide EIR is on something like that, but that's definitely a process that maybe through all this, the county can provide to streamline that benefit so that some of these providers, when they actually get allocated the money, they can fall through much more quickly as opposed to adding more bureaucracy to burn up the money before it hits the ground to help people out. I have another question on the first round. So with Golden State not getting awarded and Comcast getting awarded the first round, who fills out the paperwork for these, for the grant process? Was it Golden State themselves?
Yes.
How did we come up short?
So the process, do you mean short in terms of?
How did we
getting
not get the
accepted?
grant as opposed to Comcast doing it and us, you know, RCRC? I mean, at a certain point throughout this entire process, now I understand, you know, changes and everything, but the urban and city areas were so far behind what RCRC had put together through Golden State because they were trying to navigate how they're going to go through the process while Golden State's like, here's what we're going to do. And then the state sort of, while the state does what they normally do, hurry up and put in your grant. But wait, we're gonna put requirements on it later because we're still trying to figure out how we're gonna delegate this money. And throughout that, they actually, some of those requirements were done around what Golden State moved forward on. And now we're at a point. So how did we come up short?
So I can talk a little bit about the awards that happened in other areas and other counties. Well, first, most of the counties were awarded a partial award, right? Only part of the money's got allocated. And a lot of the awards that were given were lower cost, right? You know, yeah. And those specific applications often didn't include all of the locations that would have been required to show a business model. When Golden State Connect submitted theirs, they included a lot of, you know, existing homes where they said, you know, this will be part of a business model and it will support this entire endeavor. I believe that in their newest application, they focused more on actually the unserved and less on, you know, sort of justifying the business model. I believe that when they were starting, because they were new, they felt they had a higher bar to reach in order to show that they could deliver.
But how does that work if Monterey was the other county that didn't get round?
There was also a Golden State Connect application as well.
Okay.
Yeah.
Well, I mean, I know because we were both there at the same time and we advocated.
Rural area in Monterey.
Yeah. It was all of the ones that got pushed off, if I recall correctly, were all rural areas.
Right.
Right. And that specific part of Monterey is a rural farm. Yeah, that is. Yeah.
Okay.
Thank you for the answer. I appreciate that.
Yeah, sure.
You took the, do we have any other comments? I just wanted to ask about, sorry about the digital equity, because that was sort of what I was basing my little argument on. But I want to go back to something that Len said, and I brought this up the first time the Golden State presented. Why aren't we looking more at satellite? I mean, a satellite hookup is $349. And I think by the time that we actually get service to people, it's, what's that?
Millions.
Yes. I mean,
Right.
it's $80 a month for service. And I mean, just out of curiosity, how many households do you think we need to reach in our county?
We have, do you have the number off the top?
I think it's around 7,000. I don't know why that number sticks in my head. I could check. And
Okay.
part of the issue with that argument is that the original funding was specific for fiber.
No, I get that, but
Right.
can we start investigating some other way to
Yeah.
service our people? And I think that, I mean, again, when I was building my house, they wanted me to put all these wires in the walls and charge me a fortune to put all the wires in the walls. And I said, no, and everything in my house is wireless. And if we just look forward, I think that there's got to be a solution that we could, instead of, I don't know, the way to stop your head from hurting is stop beating it against the wall.
Yeah, and I think that there's a few things that are playing into the other technologies, right? Blue Origin or Kuiper, I think is what it's called, the Amazon version of Starlink is launching soon. So there's going to be competition in that space, which is going to help as well.
Right.
I think the biggest challenge that you run into with satellite is maintaining the connection, right? Where it's cheap, you can get a satellite dish for $300-$400.
Yeah.
And then your connection, depending on the speed you need, run from 80 to 150, right? That's cheaper in the
Yeah.
short term. Fiber has a life of like 30 years.
All I can tell you is sitting in my living room watching television, I don't get the spinning wheel of death
Right.
on satellite. And I did when it was hardwired, and it was driving me crazy. And
Yeah, it's
The difference between HughesNet
Yeah.
and what we have now
Yeah.
is significant. Yeah, and I was just running the number real quick.
thank you.
We could provide to the other 7,000 people for $2,450,000 initially. I think it's almost smart.
that's for the first year, right? So.
Well, but
Yeah.
continue,
Yeah.
providing them with it. I'm sorry, we put in hardwire. I'm still paying for my Comcast. So I don't care what it costs in the future. That's their problem. That's my problem.
Right.
You know, it's our individual problem. Initially getting it there, we could do it for a lot cheaper. Other than the only consideration I would throw in there is snow and Arnold. And when those dishes start getting covered, you know, so.
That
And actually, yeah. but-
Well, when it's snowing harder, it doesn't even matter if you go out there with your broom, because I would put a thermal heating in it, you know, and then you lose power and you lose it anyway. So.
What's cool about it is it does adjust to meet the satellite. So when it adjusts, it all kind of came off. So I didn't have to get up there and clean it.
Yeah.
And there's also the fixed wireless technology. We have like Conifer Communications here in San Andreas, Ron Mobley. I mean, we have different fixed wireless opportunities as well.
Right, yeah, I'm personally excited about the satellite stuff, but to be fair to the other infrastructure types, one of the reasons why fiber is a strong, was considered so strongly is just for emergency situations, right? If you've got buried fiber, you don't have those outages, right? You have more opportunities to make sure your emergency communications go out, especially in poor weather or fires or those kinds of things.
Thank you.
Just so you know, a majority of the situations is the fiber's buried up along the highway till you get to said point, and then it's no longer buried.
Yep.
And that's, you know, I completely hear you and I agree with you. But, you know, unless you live on the highway, which I didn't buy on the highway for a reason, because I don't want to listen to it.
Is there any public comment regarding this item? Do we have any comment online? Do we have any other board comment? Super.
Thank you.
Thank you.
Oh, did you have?
I was just gonna.
Yes.
I was just gonna make a quick comment. Sorry, I use these so I can hear you guys. I have Starlink at home and we've been using it for quite some time. My wife works from home, so she has video calls all day long. It's worked exceedingly well. Grant you, I live in your area, Autumn, so we're down there between Valley and San Andreas. But I just looked up the current, if you were to sign up for it right now, and you can get it with zero installation cost at $120 a month for residential service right now. So, and if you get the light, which I didn't look at what the speeds are, but I tested my satellite speed yesterday and I had 350 megabits per second, which is pretty screaming fast. Compare that to the AT&T through phone wire that we had, it was 5 megabits best. So that's a potential way to go. I was gonna say another alternative is in certain market areas where AT&T has cell installations, which we have in that area, pretty good. They have a wireless data link, unlimited service as well, and I do not know what their charges are right now, but I know I get about 15 megabits per second on my cell phone at home there as well. So alternate options.
Great. Thank you very much.
Thank you. Yeah.
Thank you, Madam Clerk. We'll move on to item number 27, our last regular agenda item.
Item number 27 is an informational item from Public Health. Receive a CalFresh presentation from CalFresh eligibility and education staff for CalFresh Awareness Month.
Good morning.
Ladies, morning.
My name is Gwen Barnes, and I work in the CalFresh Healthy Living Program at Calaveras County Public Health.
My name is Jennifer Pruden. I am an eligibility supervisor at Health and Human Services in the Eligibility Division.
So our presentation today will be about 15 minutes. If you have any questions, please hold them until the end. Thank you. Okay, so today we wanted to bring the CalFresh program to your attention because May is CalFresh Awareness Month. We're going to be talking about the CalFresh program, who the CalFresh program is for, common misconceptions that there are about CalFresh recipients, and what our program does to meet those needs. So CalFresh nourishes our community. Slide. Sorry. Okay, so CalFresh nourishes our community, mind, body, and soul. So CalFresh nourishes the mind because healthy living, our program delivers nutrition lessons across the community, which empowers healthy choices at every age. A small change makes a big difference, and a balanced diet improves mental health, and a healthy gut helps a healthy mind.
Body. Promoting a healthy diet combined with movement. So our program goals are to improve the health for low-income community members by promoting sustainable, healthy behaviors and environments. We encourage a healthy diet combined with movement.
Okay. And soul, CalFresh gives people an increased sense of control and empowers them. Food isn't just food, it's connection. So if I could ask you guys to participate for a moment and close your eyes, it would be greatly appreciated. Both of them.
Whatever you're
okay. I want you to picture sitting down when a meal is being cooked with your favorite people. I want you to think about the sounds that you're hearing. I want you to think about, do you hear sizzling in the pan? Do you hear people laughing? I want you to think about, what does it smell like in there? Is it nice? Is it yummy smelling? And then what does the food taste like? Is it your favorite food? Is it a food your mom made for you? Okay, you can open your eyes now. Thank you for doing that.
Right before lunch.
With reliable access to food, CalFresh recipients can dedicate their energy to personal connections and human experiences like the one you just thought. So what is CalFresh and who is it for?
So we start with CalFresh Food Assistance. This program helps our income eligible community members to be able to purchase groceries. They can even buy things as seeds to start their own gardens, vegetables, things like that. It actually even helps moms buy formula for their children. This supplemental program does provide access for our eligible participants. It's something that providing food to the families of our community members is our top priority.
And the CalFresh Healthy Living Program is a program that helps eligible community members learn more about making healthier food choices and being more physically active through classes. Okay, so CalFresh is a dynamic program that is designed to help our community members, but there are some common misconceptions.
So a common misconception with CalFresh eligibility is that you have to have no income to receive CalFresh. I pulled some current data. We just had the Food Equity Summit that was hosted by Mariposa for CMCA this year. Over 70% of our households are food insecure and they have income in their household, which means they are working and still not able to meet the needs to provide for their family. They're working within our federal poverty guidelines. Also, another misconception is that CalFresh recipients can buy whatever they want. You can't buy hot or prepared food. The point is for you to purchase food that you prepare yourself and that someone's not prepared for you. Obviously, during disasters, there is waivers put into effect because not everybody may have access to a kitchen or have access to somewhere to prepare. And those are just on circumstance based. The other thing is you can't buy alcohol and tobacco, which is another misconception. I see people buying cigarettes with their CalFresh money. That is not possible. It's not even available to them. It is a supplement program. It's also not based to be your only form of income for food. It's just a supplement to be able to provide for you. I do have a personal story I'm just going to share with you guys. Many of our staff that administer eligibility were once CalFresh recipients. I think that goes to show you the impact our program has. It actually, for someone to participate in a program and then be invested in it because it provided food to their families and then want to work in an organization that administers that is huge because you've seen the benefits to it. Many of our staff have shared their stories at summits, at stakeholder events, saying how important CalFresh has been to be able to provide self-sufficiency for their families.
Okay, so why is CalFresh needed in Calaveras County? So it's tricky for Calaveras County community members to get the nutritious food that they need sometimes. This is because we have a lack of affordable grocery stores, the cost of living is getting higher, and we have a lack of transportation in our community. So some of our communities in our county are what you could consider a food desert, which means that it is often a low-income area where residents have limited access to affordable, nutritious food like fresh fruits and veggies. And it's typically because they can't access those stores because you have to go so far to get to them. A lot of our residents can't conveniently access these affordable grocery stores, so they end up shopping at gas stations and mini marts instead of grocery stores.
With our cost of living, we find a lot of people are having to make a choice between if I have the gas, am I going to drive all the way down the hill to go to a local grocery store that's in the county because it's closer, or am I going to spend the gas to drive cross county to find something that's more affordable, a larger big box, you say, value store?
And the last thing is the lack of transportation. So unlike an urban area where you can just hop on the bus and go straight over to the nearest grocery store, or you can walk to a lot of grocery stores too, we don't have that kind of accessibility here. So one of our biggest things that we found in our community health assessment with public health a few years ago was that people really felt that there's a lack of transportation in our community. That was one of the biggest things people mentioned. Because of that lack of transportation, it makes it hard for people to get where they need to go. So just think about how far you have to drive from West Point, on a daily basis if you want to get all the way to the grocery store. It's a long trip. So these things are all difficult, but we really wanted to highlight the price increases that we've been facing.
So for an average CalFresh household, the maximum benefit could be $292. For every dollar of income, that changes and fluctuates on a pendulum, and it goes down to as low as benefit amount is $23. So if you look at that scale there, an example is our elderly and disabled population who are on fixed incomes get $23 of CalFresh a month. What could you buy off of that for $23 currently at our local grocery store? Not much. It may make you choose between, yes, I could get bread and eggs, but I can't get a protein or I can't get a vegetable, and probably definitely not a locally grown one that could cost more. So that's just current some of the food items, but obviously we all know from grocery shopping, the cost of goods have definitely increased.
So our community faces many challenges, but our programs do make a difference.
It's okay. Okay, so as you can see, we've had a significant uptick of CalFresh cases. In 2019, we were holding, and this is households, this isn't the amount of people we serve. So every household could be from 1 to 6 people. 2024, and I did this morning, we just validated last month's numbers. We were over 4,000 cases. We're like in the 4,200 range right now. So at that top right picture, Stephanie Kearney, the staff analyst for CalFresh, and I were invited to the CalFresh Operations Roundtable by the Department of Social Services. Calaveras has been recognized for the ability to have exceptional program access for being as rural as we are. So they asked us to present like how we do that. And we talked about the relationships we've formed within the tribal communities, within our food bank, how we partner together, and our outstations. Our outstations have been the biggest accessibility for people. It was really great for a little county like Calaveras to be able to the state to say to us, like, would you come and present and explain? And even people from large counties, LA County even said, like, there's pieces to that we need to do better on that we could do just from your presentation. So it's not a small county, large county thing. It was really just about, you know, thinking outside the box. We actually had somebody from the state who said, like, I just didn't put the correlation together about food bank and CalFresh. And I was like, what? But you know, when you're sometimes siloed, that can happen, right? Their question was, well, like, how did you make that correlation? I'm like, well, we were out of food bags at the office and I drove and picked them up and I built a relationship with the food bank director that way. Just going and meeting people, like, how can we serve our clients to the best of our ability? So the other thing, the outstations, of course, but anywhere that we're allowed to present about our program, we do. So the bottom picture is one of our lead workers at the Children's Fair last year. Anywhere where we can table event, we're there. We staff it, we figure out a way, because even if we just reached one person that day, that was it. And anybody who works those events can talk about any of our programs, not just CalFresh. So that's really helpful for people. But it's been great to be recognized by the state, but also know that we are really trying to reach in the most densely poverty-stricken areas of our county.
So CalFresh Food Assistance gets people the food that they need, and our other program, CalFresh Healthy Living, teaches people how to make healthy choices with the food. So you can see some pictures up here from classes that we do. This is the program that I work in, and last year we saw about 526 residents with nutrition education. We teach people all ages. So we teach kids and we teach all the way up to senior citizens. And it's all really fun, honestly, which is the best part. So with kids, we try to focus on nutrition basics because kids don't really get to go grocery shopping. They don't really choose what they're buying at the store, but we can empower them with the choices to make in the lunchroom, or maybe at a snack or at a birthday party. They can make a choice that they'll get to have on their own. And a lot of the kids do. You'll see that they do learn a lot, which is really fun throughout the years that you get to see them. We take them out in the school garden and they plant things from seed all the way to harvest so that they can see where their food comes from, which is very fun because they, as you can see here, they love being out in the garden. They love wearing the gloves and digging in the dirt. Mostly they love digging holes, is what I've learned. We have two community gardens, one in West Point and then one in Moke Hill that we're developing right now. That are really fun. We take the kids to, and then 3 of the school gardens that I get to work in. And there's more CalFresh school gardens as well in the county. For adult education, we focus on the nutrition basics. We teach things like shopping on a budget, like how to take on the grocery store, how to save money, how to shop for one person maybe, or how to cook when you don't have a full kitchen. We also do cooking demonstrations with all ages, which is really fun. And for some upcoming projects, we're going to be doing a food waste reduction competition at West Point Elementary this fall. Should be really fun. Basically, that means that at lunchtime, all of the classes are going to compete with each other, and they're going to see who can reduce the most food waste in that week. And at the end of the week, the class that wins will get a yogurt parfait party. That's going to be their incentive. Really fun. But these competitions have actually been proven at the schools where they've been done to lessen food waste throughout the whole school year for the schools, which is a really big problem in a lot of schools in America. We're going to be doing some caregiver nutrition classes. So teaching parents, guardians, nutrition basics and ways they can feed their kids, and also ways they can introduce their kids to new foods, because kids can be pretty picky. So just things like that that'll help them out with raising their kids. And we're going to be doing some senior movement classes, because movement is a really big part of our education that we do. Is moving your body is really big for health, and it's just as important as eating healthy is. So today we went over CalFresh, what it is, why our community needs it, and how our teams show up to meet those needs. We are so grateful to be in the programs that we're in, and we're very proud of the work that we do. So CalFresh nourishes our community, mind, body, and soul. And Jen's team especially does a lot of hard work to put food on the tables of community members. So how can you help? You can support and uplift community members who use CalFresh. You can empower yourself with nutrition knowledge and make small changes in your life. And you can know that it's okay to ask for help. Thank you so much for coming to our or I know you're here anyway. Thank you so much for listening to us today. We really appreciate it. And if anyone needs to reach out to us, our community or our contacts are right up there. And we wanted to leave you guys with a question.
Did anybody learn anything today about the CalFresh program that you did not know before?
Yes.
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 And do you have questions for us?
I just want to say I have a lot for you, and I'm gonna take it offline because, and it's not to demean you or anything. You everything you do is so great for the county, but I think everyone's excited about touching frogs.
That's fair.
So, awesome job. Thank you.
Thank you.
Same thing. I have some questions for you that I think maybe offline, I'd like to talk to you about. Thank you.
I'll just praise you real quick. I've been on school campuses and seen Gwen come in and it's like a celebrity sighting. The kids love it.
Thank you, Gwen. Thank you, Jennifer.
Thank you.
I just love the work that you do with the children, because I think that's so important. Because the one thing that you didn't say that I really know is true, because I did a program once on trying to get low-income families to eat properly, is that the kids will also bug their parents to eat properly.
Yes.
And it's so hard to get, once you're in your habits and you're an adult, it's so hard to break that. But those kids were really on their parents.
Yeah, we've had parents tell us like, oh, I had to switch off soda. So my kid got on me about it.
Yeah. So thank you so much. Is there any public comment? We have an informational item here. Any comment online? Thank you. Thank you so much. So quickly, could we move on to supervisor announcements? Supervisor
Frogs.
Supervisor Toffenelli?
Nothing.
Supervisor Pollendorf? Supervisor Andal?
Yeah, too eager to go jump a frog.
Okay, I'm going to talk really quickly. I just want to say on the 23rd, we said thank you to Bertha Underhill. And I just really wanted to thank for all of her work in District 3. We did the Firewise on May 3rd, which was amazing. And we're going to be doing it in June 14th. And on the 6th, I was able to interview Avery Middle School. And thank you for doing the special meeting after that. I just am so impressed by the kids and what they are accomplishing and how well coached they were. Say. And on the 7th, we had the Michelson Science Fair with Debbie Strand, and a huge thank you to Debbie Strand for all the work that she does. And then we did the Rock Creek ribbon cutting on the 8th. I did need to ask the board. Alicia Hanks from ATCA would like to come, and after doing her presentation the other day, she wanted to give us a formal presentation with the board. Invite them. Thank you. Thank you. So we'll do that in the pre-agenda. We'll decide when it goes on. Okay.
I'd love to see it.
Super. Anybody else? Anything else? Thank you all.